Welcome, let's begin with Kurukshetra, the November edition. Now this focuses exclusively on rural health, a very important topic in light of the Ayushman Bharat scheme that has recently come up. So that's something that has been the sole focus here. So Ayushman Bharat, the Poshan Abhiyan, that's the National Nutrition Mission, again a very important topic, a very burning topic for your mains examination. Swasthya resource kit, you have the concept of telemedicine coming up. So this is a very kind of innovative method where you have the doctors sitting in remotely and monitoring the patient. So you have the telemedicine concept that we would be discussing in detail. The concept of Kalp, which is a kind of clean hospital campaign, breakthrough under the Swachh Bharat Abhiyan, Asha workers which are accredited social health activists. So these are some of the major things that would be the focus of today's class. In the next issue, we would be focusing on science and technology for rural development. So Ayushman Bharat, we have already covered it in detail in a separate lecture. Since it's a upcoming topic, it's very important for your prelims as well as mains. So we have the Pradhan Mantri Jan Arogya Kendra, which would provide coverage up to 5 lakh per family per year. The number of family members are not restricted under this scheme. All the families which are vulnerable entitled families would be given a first preference, and this would be a cashless and a paperless access to the services which are being provided. We are also focusing on ODF, that's the Open Defecation Free India. So we have numerous states and districts which have already worked forward for it, and we are achieving the targets for 2022, where we talk about a new India, transformed India and a clean India. As per the Clean India, we have numerous women organizations which are working around as self-help groups for the promotion of it. The next is Swachh Bharat Mission. Swachh Bharat Mission, as we already know, has now started as a mass campaign under MNREGA, that's the Mahatma Gandhi National Rural Employment Guarantee Scheme. You have numerous employment schemes that are being promoted for the cleaning of the India, and the promotional activities, encouragement of the local people, the help by the Asha workers and all these midwives. So those have played a major vital role in the promotion of Swachh Bharat Mission in India. Similarly, we have recent developments that have come up under MNREGA. So that's the construction of the Lingpoi water tank, which is seen in Aizawl, Mizoram. Under Ayushman Bharat, as we said, we have two important components. The first is the comprehensive public health care. The next is the Pradhan Mantri Jan Arogya Abhiyan. So this system, we focus on the primary health care, then the community health centers, and then you have the tertiary level health care where we have the specialized hospitals that could be seen. This implementation would occur through the National Health Mission. The inputs would mainly be the infrastructure. This scheme is already set to provide a huge number of employment base to the people. You have under 5 mortality rate that has significantly declined in India, and this decline has a significant drop from 2.5% to nearly 8%, which is a really commendable figure, we can say. We do have sustainable development goals that have come up and numerous estimates. So through the health workers, we are working around Ayushman Bharat, where we can work around knowledge for partnership, a good IT system, a good payment reforms infrastructure, the cashless paperless delivery mechanism that we talk about. So under this, we would have a package of service that would be provided, which would be beyond the maternal and the child health care. We would also have the mid-level health providers which would be there. There would be expansion of the health centers that would be seen, the primary healthcare units that would be seen, and similarly digital apps, upgradation of the softwares. You have Mera Aspatal app that has been recently inaugurated. Similarly, there are programs which would come under the Jan Dhan Yojana, the Pradhan Mantri Arogya Yojana. So those would have been a part of Ayushman Bharat. 2 programs have already been subsumed under it. One is the Rashtriya Swasthya Bima Yojana, the other is Senior Citizen Health Insurance Scheme. So that has been a significant breakthrough. We have 3 different categories: the trust mode, the mixed mode and the insurance mode. The different states falling under different categories have been mentioned here. So under the insurance scheme, insurance mode, we have the 7 states, mainly the hilly areas, and then you have the island territories along with Punjab that are part of it. These are being managed by various national health agencies. You have numerous memorandum of understanding that have been signed, and under WTO we have WHO, that's the World Health Organization, we are talking about a healthcare series that could set up an example globally. So it includes patients, individuals, the population of the desired health outcomes that are being witnessed. The next is we are working towards communicable as well as non-communicable disease. So this would be the world's largest fully government funded scheme providing support to so many people. So it's definitely a big challenge for the country. As a result, you have huge number of breakthroughs that are required. Collaboration from even private hospitals are going up. The present situation, we can say, we do have the medical regulations that are there, which are under the Drugs Act. So Clinical Establishment Act 2010, the Drug and the Cosmetic Act 1940, and the various professions such as Medical Council of India are working together. However, now this MCI has been disbanded. So you have issues that are coming up on day-to-day basis. These issues could be in the form of lack of accountability, lack of transparency, lack in quality of services, corruption that is seen, red tapeism in certain parts, management gaps that are seen, fixed salary which does not provide a real incentive to work. So those are some of the challenges that are to be addressed. So that's something that is under the Ayushman Bharat, which we are working towards an improvement sector. Again, India's healthcare sector is among the largest in the world. By 2020, we have around US dollars 280 billion that could be expected. There are immense challenges, however. The out-of-pocket expenditure is very high in India. The financial protection is very low. The health insurance coverage among the general public is very less in India as compared to other nations. So to reduce the financial burden on an individual or the poor, we have the Ayushman Bharat that has put up a thrust. There are two major initiatives under this. First is the Health and the Wellness Center. The next is the National Health Protection Scheme. So nearly 1.5 lakh centers would come up in case of the healthcare systems. For the healthcare protection, we have the coverage that we have already talked about. So if we could look onto the timeline, since from 1st February when it was announced, in a period of merely 6 months, there have been various incorporations that have been taken into account, the various appointments that have taken place, the Ayushman Bharat Divas that has been celebrated, the various MOUs which have been signed, and finally this was declared on 23rd or launched on 23rd September. So this is definitely indeed a very important initiative, and one very important thing that you need to know, for one medical college is set to establish for every 3 parliamentary constituencies and 1 government medical college in every state of the country. So that's the basic line that we need to achieve. So we have certain statistics which are there for out-of-pocket expenses, the borrowings, the expenditure pattern in case of healthcare. So all these need to be worked around, and this is something that's really important as a kind of substantial information for your mains, for your answer writing. The helpline number is 14555, and therefore this we can say is a kind of innovative scheme, brings along the scheme of Roshni, that is Registry of Hospital and Network of Insurance, which is very important, and the National Health Resource Repository. The next is Poshan Abhiyan, which is the National Nutrition Mission that we are talking about. It was launched in 2018, aims to improve the outcome of children, pregnant women and lactating mothers. So you have a significant improvement that has been seen. In the list of 10 countries, India is ranked first in terms of the stunted children. So definitely there is a big way moving forward for the change and the developments that we need to take into account. The undernutrition levels, the stunted growth, the malnutrition that's seen in India needs to be addressed. Some of the pillars of the Poshan Abhiyan is the convergence of the various responsibilities of the various departments that could be seen, and a proper functioning and good accountability could lead to good results for the Poshan Abhiyan. So it basically focuses on first 1000 days of the life, where we say 85% of the mind is built up. So the development of brain occurs in the first 1000 days, 85% of which is developed, and those are the critical period or the critical stage of the good nutrition that should be provided. So that should be in the form of supplements, the nutritional supplements that could be given. and again a good service mechanism that could be present. Educating community is again a very important aspect where information on good food, hygiene, healthcare is being provided not only to the adults but even to the school going children. India has a huge lot of tribal population. We say of the 705 scheduled tribes, we have 75 particularly vulnerable tribal groups that are present across various ethnic and the cultural standpoints that are seen. So the largest number of the tribes are seen in Madhya Pradesh, followed by Maharashtra. In terms of proportion, as we say, we have high proportion which is seen in Tripura, Manipur, Arunachal Pradesh and the northeastern states, even in the island states of Lakshadweep and the other and Nagar Haveli, the union territories. We also have the highest death rates of tuberculosis which are seen in the Saharia tribe of Madhya Pradesh. So health issues become an important focus in the tribal population of India. Kayanur forest disease, which was recently seen in the areas of Western Ghat, mainly in the tribals, is again an important challenge. So working around the awareness for the tribal people, the ICMR is working for theatre based communication approach, mainly in the Bagchak areas of Dindori, Madhya Pradesh. We are working on the various healthcare centers, transportation facilities in case of emergency situations, good behavior by healthcare providers in the tribal areas, working around the financial constraints for the tribes. So financial security under the Ayushman Bharat could be covered, and this is one of the important thing that we need to understand. The next is the infrastructure in India. So at the lowermost level we have the sub-centers which cover 3000 population in hilly areas and 5000 population in the plain area. The second level is a primary health care which has a population of 20,000 to 30,000, community health centers with 80,000 to 1,20,000 population that is seen. Then you have National Health Policy 2017, very important. We already had that in our test series program for geography optional. Even for your GS, this is a very important topic. So how the access to the public health care is important. The public health care expenditure has been rising in terms of GDP, and here are some of the important points that we need to address for the National Health Policy 2017. Under the budget, the allocations for the Ayushman Bharat and the health and the wellness centers have been indicated, which are again important. The health concerns for the adolescent girls are again important. 21% of the population is adolescent, so good health and nutrition is very important. Health challenges are important, so good awareness, lack of knowledge, lack of attitude, kind of positive attitude is something that is to be addressed. We have numerous government schemes that have come up. One such scheme is the Kishori Shakti Yojana, which was launched in 2000 to improve the health and the nutritional status. We have the two schemes which have been combined under a pilot basis. Those are the Rajiv Gandhi scheme for adolescent girls, that is Sabla scheme that has come up. Empowerment and development is something that is to be addressed, making people self-reliant. So we have the adolescence that has been marked down as early and late period, and we have different authors which have classified them under different categories. Some of the important problems that need to be addressed for the adolescents have been mentioned. So those are really some of the issues that we need to work around. Now what comes is something that's really important, and that's the approach for the adolescents. So first is the life course approach, which talks about early childhood to adolescence and how the growth has taken place. Ecological models talks about two-level intervention. One is at the family level, the other is at the level of the society. Human rights based approach talks about the implementation up to the targets that are set up. Heterogeneity talks about the similarities and the differences that exist, and finally is equity, that's building up of the different concepts together. So you have the Rashtriya Kishor Swasthya Karyakram, which has 6 parameters. These 6 are really important. So this could be again a question, what is the Rashtriya Kishor Swasthya Karyakram? So you need to know these 6 points and address those 6 points. Then you have certain interventions that have come up. So the hygiene and the peer program are some of the important aspects that have been covered. Swasthya resource kit is again important. You have peer educators which have come up, which provide age appropriate knowledge. You have mobile app that has been linked to the Swasthya resource kit, and that is in the name of Swasthya helpline. You have the helpline number that's there. Now mobile connectivity is again what's important. So the ASHA workers which are working across the rural areas have been connected through the mobile network, through the various WhatsApp groups, and this has been a kind of game-changing initiative. You have M-Sakhi app that has come up, which has been downloaded by numerous health workers. This helps them to maintain or track or supervise the health records, the health data on a nationwide scale. You have to go up in 6 different languages. It has a voice portal and a mobile app. Mera Aspatal, which we already talked about. You have other initiatives like Mission Indradhanush, which focuses on vaccination and immunization programs. So those are some of the real important points that we talk about. Telemedicine, as we talked about, is very, very important in highly underdeveloped areas where actually you do not find good doctors, or for a doctor it's hard to reach out. So the parts of Africa, Zambia, Zimbabwe are some of the areas where you already have this telemedicine going up. We are working with this telemedicine in India. So you have as many as 550 million internet users as of now, which is a good potential to bring this onto a thrust. So you have a doctor sitting in a hospital, you have the ASHA worker or a kind of midwives that are present at a PHC, and those could be guided by the doctors present there. And as a result, a good initial care could be given by means of telemedicine. Hospitals are also using up telemedicine. Apollo is the first to set up this in the rural areas in Aragoda, that is near Chittoor in Andhra Pradesh. Similarly, AIIMS and Sanjay Gandhi Hospital, Lucknow has been working for the same. US and South Korea have been doing it since 1980s, and there has been significant development. Sanitation revolution is again very, very important. Gandhiji's collaboration or contribution is something that cannot be missed out. You have ashram observances which are seen in action. That's one of the books that he has written, which talks about the services in essential, and these are considered to be sacred services. Celebrating Gandhi Jayanti, we celebrate it as Swachh Bharat Divas. We have women helpers which are coming up. Clean Hospital, which is another important campaign. The Kalp scheme was launched in 2015 under the Swachh Bharat scheme, and so far we have seen phenomenal change in the quality of the public hospitals that are seen. The mechanized cleaning devices have been introduced. You have signatures that have been put up across the AIIMS campus, electronic scroll boards that have been seen, washroom checklist has been put up, and biomedical face control and protocols have come up. National Health Agency has been established in 2018. This is under the Society Registration Act, and this would provide a kind of overall vision for the development. E-governance is another important vision where we are talking about providing facilities in the remote areas, inaccessible areas, helping the human resource groups working around patient safety, the geographical dispersal, and the participation of the local people. So you have the Anaemia Mukt Bharat and the home-based young children portal that has come up. So those two are again important efforts. Under the government efforts, we have already talked about the health programs, the Rashtriya health scheme that we have talked about. We have Rashtriya Bal Swasthya Karyakram and the Balika Samriddhi Yojana. The Bal Swasthya Karyakram focuses on 4 Ds, that is the defects of birth, deficiencies, disease, developmental delays and disabilities. We also have ASHA workers which are working for rural areas. We have numerous women residents who are working in the age group of 25 to 45 years. We have 10 who have been considered as standard, and they are literate women who are working through it. Then there is these ASHA workers act as the first port of call. So these people would be the first to be addressed, and then you would have the difficult things that could be handed over further. As now we would be discussing more topics on our Yojana and Kurukshetra. So stay tuned on the channel. If you have any doubts, any questions, feel free to post those in the comment, and we'll be more than happy to resolve your doubts. Have a very great day ahead.